natural experiment is something that has happened. The most common form of natural experiment would be a policy. So a policy is introduced, it wasn't trialled, there's no intervention group who get the policy and a control group who don't get the policy. It's rolled out without trial. The natural experiment then says, can we find something comparable? Can we make this comparison? Can we look at a place where the policy hasn't been brought out, such as another country? Or can we look within country at a time where there was the policy and a time when there wasn't the policy? So this is taking something that has happened and trying to look at whether it worked or not. The things we have to look at in particular are the data we're using. The health data are well developed, they are improving all the time, more data coming online, but we have to look at linking into other sources of data. So, for example, linking health data to education data, linking to welfare data, linking to criminal justice data, linking potentially to tax data. Yes, the Nordic countries are a long way ahead of the game. They have a unique identifier that follows every citizen from cradle to grave. But this links not just through health data, links with all of the data. It is also a different culture. We have problems in the UK and I guess in Australia too with asking people about income. It tends to be a very personal affair. In Norway, a salary is a matter of public record. You can go to a website with someone's name and address and find out how much they earn. In Finland, it's the same thing for anyone who's a company director. Their salary is a matter of public record, and also for anyone who works in the public sector. So a civil servant or someone working at a hospital, their salary is open to public scrutiny. These things have developed rather differently. We're not used to that. We have Anglo-Saxon sensibilities, and understandably people are reluctant to let their data go. But the more we can convince people that there's no threat involved, the more information we can get, the more we can use the data. The routine data, the linked data, is really about providing information. You need to be able to describe the problem when you know the problem's there. And once you've described it, you can start investigating deeper and deeper. Work I've done, I mentioned Finland, work I've done in Finland has looked at inequalities in health. And we look in particular, when looking at inequalities, there are going to be lots of health differences, but we look at things that shouldn't happen. So in Finland, we've been focusing on something called mortality amenable to healthcare, which means deaths that shouldn't happen if the healthcare people are receiving is good and timely. We're able to look at the patterning of this by income groups. As I say, we have great income data from Finland, so we can see how strongly patterned these are. If they're deaths that shouldn't happen to anybody, they certainly shouldn't be happening more to people just because they have a lower income than others. The Nordic countries come at the top. They're the gold standard that everyone looks at jealously. But after that, there are countries like Scotland, not even the UK, and Australia. Regionally and collectively now, Australia's data is amongst the best in the world in this second tier. The linkage is very good, the health data are there. The need is to, as I said, develop beyond the health data and into other sectors. It's being used very imaginatively, and the uses are just going to get more. This is a cost-effective way of providing data. They've already been collected, they've been paid for, So we need to make as much use of them as we can.
Mm.